So what are psychocutaneous disorders? Hi, I'm Dr. Naiya Bansal, and I'm going to talk about something which we generally do not talk about. So there are many presentations in our dermatology practice in which the condition is actually originating because of some issues or some issues in the mind of the patient, and it presents as a skin issue. So these are called psychocutaneous disorders in which there is an involvement of skin as well as the mind. So these cases can present to both the dermatologist as well as the psychiatrist and usually need a combined method of approach. So studies have shown that approximately 30% of the dermatological disorders have got a psychiatric comorbidity. So it becomes very crucial to rule out and treat the mental issues behind the condition. The various common psychiatric conditions which are associated with these dermatological issues are clinical depression, anxiety-related issues, chronic stress, and at times obsessive-compulsive disorders. Now it's very interesting to understand and identify these dermatological conditions. So I'll explain just a few of them. The first and foremost is the body dysmorphic disorder, also called as body dysmorphia, in which a person or a patient will spend a lot of time excessively worrying about the flaws in his or her external appearance, while the others might not be even noticing those. This happens very commonly these days with the teenagers, especially. A lot of teenagers come to us who are worried about their external appearance when there is absolutely nothing wrong with their faces or their bodies. So this happens because of external pressure of the peer group or the pressure of the social media, which we are all very familiar with. The underlying reason could be a chronic stress or anxiety related problems which have to be dealt with very peacefully and calmly, and family support is very much required in this. Number two is a condition called acne excorie, in which a patient presents to us with an unintentional excoriation or picking of his or her active acne or acne spots, thereby leading to very bad scarring on the face, which is almost untreatable. So the underlying condition is generally stress or anxiety or maybe depression. These patients are not aware that they are stressed out, they just keep on poking themselves. So this has to be identified that they might be having some psychiatric issues, and a psychiatric help generally helps to improve the condition further. Another very interesting presentation in our clinics is Trichotillomania, in which a child or a young adult or maybe a middle-aged person can keep pulling his or her hair unintentionally while doing some activity. While watching TV, he or she might be just pulling his or her hair, and this keeps happening for a long time, leading to presentation to us in the form of baldness. And there is a standard pattern of this condition which we can identify luckily. But when we talk to the patients, they happen to have a chronic stress, anxiety, depression, or other psychiatric issues going on. So these have to be identified in time, and patients' referrals to psychiatrists and a combined treatment with the dermatologist can surely improve the condition. Lastly, patients also present to us with a generalized unexplained severe pruritus on the skin, in which generally there is no sign or symptom of any kind of skin issues. It is just because of their stress and anxiety that they are just feeling like scratching all over their body. So we have to identify these all, and a timely intervention with the combination approach greatly gives us better results. So I hope it helps. Thank you.